Hello, everyone. Welcome to Random Talks. I'm your host, Chan, and today we've got a really special guest. Honestly, I'm pretty excited about this one. I'm here with Dr. Youssef Bassim, the head of digital and AI, as well as an executive board member at the Arab Hospitals Federation. Basically, if there's anyone who knows about healthcare, AI, and where all of this is going, it's Dr. Youssef. Thanks for being here, Dr. Youssef. How are you doing?
Hi, Chan. How are you?
Very well. Thank you. Happier now that you're here.
Really, I thank you for hosting me on this insightful podcast. It is a privilege to join you, especially during such challenging time of global crisis when healthcare it faces unprecedented pressures and demands. I'll be happy to discuss with you this critical issue and how AI can play a role in navigating us into this crisis and to drive innovation and resilience in healthcare.
Absolutely. I mean, there's a lot happening in healthcare right now, and you're in the thick of it. I'm sure we've got tons of insights to share with our audience today. So, let's get into it. Before we talk tech, Dr. Youssef, let's zoom out a little bit. I think one of the biggest issues, as you rightly mentioned, and it's on everyone's mind right now, is the healthcare crisis, right? Whether it's workforce shortages, rising costs, limited access to care, or even the global tensions that are complicating everything. You're seeing it from a very strategic perspective. So I have to ask, right? What's your take on where the healthcare system stands right now, looking at the global crisis?
Let us start with talking a bit about this global crisis and its effect. This crisis is marked by severe and interconnected challenge, and the issues that facing this crisis it compromise the ability to provide timely and effective care, and it exacerbates the healthcare disparities and it heightened the urgency for sustainable solutions. Okay, you can start. It happened. This started in the COVID-19 era when we started having this shortage of workforce. The workforce shortages, it is we are facing. It was global, and it was unprecedented precedent staff shortage when you have a burden that was worsened with the pandemic, and we had an increase in burnout and high attrition rate. Okay, and it affected patient care quality, and it led to increase in waiting time and impacting outcomes and patient satisfaction. This is about the workforce. In addition, with technology, we're facing a problem in the cost in the healthcare. So there is a rise in the cost in healthcare, especially with technology. And it is the cost, it is this healthcare spending, it's growing faster sometimes than the GDP in many countries, especially the poor countries, which is driven by increased demand, expensive technology, and the complex care needed. Now it's changing. Things are changing like before. It started, yes, with COVID, but now with the technology and with AI, things are getting more problematic because, in each technology, when you implement a new technology, first, the initial phase, it will be costly. And now, in the initial phase of implementing those technologies through AI. So, this high cost, it is causing a limit in individual ability of governments to sustain funding, particularly in lower socioeconomic settings. It also at least the inequalities. Maybe we'll talk about it later. Access and the equality, the access to healthcare, and especially when you have advanced treatment.
Mm-hmm.
Which are often they are out of reach for the underfunded facilities and or the uninsured patient.
Mm-hmm. Mm-hmm.
We talked about limited access. It remains uneven because especially in rural population, in marginalized communities, and in low income countries, we have limited access to that it exacerbates has inequities, and it lead to worse outcome for vulnerable populations.
I mean, it's definitely a tough situation for sure, right? And as you rightly said, it seems like AI could be a key player in solving some of these challenges. Dr. Youssef, you spoke about workforce shortage crisis. I came across a stat from World Health Organization, and honestly, it's pretty alarming, right? The WHO report states that by 2030, we could be short of 10 million healthcare workers globally. That's a staggering number, especially when you think about the strain that puts on an already overburdened system, right? How do you think AI can close this gap for healthcare shortage? Yeah.
Let us start first by talking a bit about the fear of AI, because we are having a shortage in resources, and at the same time we need to rely on AI. But we need to make sure that everybody would understand that AI should not be considered to replace us. It should
Yeah.
complement us. So, complementing us, it will be very helpful, especially as you said that the expectations in 2030, there will be lot of people in the healthcare workforce. Okay, but we should keep in mind that we aim that to use AI in complementing our work. Unfortunately, this is a discussion. I don't know. There is a fear that sometimes it's going to replace us, especially in some specialties, in some tasks in the healthcare. So today I'm going to to talk about the positive outcome from AI. I don't want to be pessimistic because I guess we can benefit from AI, of course, and well, let us leave the problem of this scary future that we'll face of what is going to happen later on. Just I give you one thing that recently Elon Musk, he said that in 2040 we're going to have humanoid robots more than people on the planet.
That's scary.
He was talking about 10 billion humanoid robots. Initially, he talked about 1 billion. Now, a few days ago, he said it is 10 billion humanoid robots that will be functional
Mm-hmm.
2040. So the future is.
So how do we? True, but how do we stay optimistic about this, Dr. Youssef, when when you know that AI is going to replace human being in that sense, how do you remain optimistic?
I want to keep on convincing myself that I want to use AI as complementary. This is why. Okay. But unfortunately, the technology is ahead of us. We are not able to keep in pace with it. But I have to be optimistic. I want to make use of what is being done now. So far, it is all positive what we're using from AI. Still, yes. But yes, we have to make sure that the culture of AI among the population should be properly known, and all people should be ready that, let's say, in specialties, in doctors, there are some specialties, they should work more on, let's say, working on interventional, let's say, in radiology, in pathology, and there are things that they should do it in dermatology, those specialties should work more on interventional because replacing us direct physically on the patient, it's going to be a bit premature to talk about it now. So this is one of the things that for the physicians' specialties.
Look, I love that, I love what you said, Dr. Youssef, that it's not about replacing people, but it's about giving people more time and space to focus on what really matters, especially in an industry like yours, which is healthcare.
Exactly. This is what I wanted to talk about. That now AI is helping us have more time to take care of patients. It will do the routine work, and the doctors now will have more time on working with patients. So we have a lot of things that AI can help. If you want, we can talk a bit about it.
Absolutely, absolutely.
Yes, AI now it will take over many repetitive administrative tasks for the in the healthcare field. So, like scheduling, documentation, billing, and patient record management. This it will freeing up healthcare workers to focus on patient care. Okay, so this is very important. As for the clinical decision making, uh, it's very important to know that AI decision support tools we have now, the clinical decision support tools uh, operated by AI, they can provide the healthcare workers with instant access to diagnostic recommendation. So now it's easier on us to proceed working, and we don't have a lot of time searching in order to come up with the proper diagnosis, whatever. So we can now have better recommendations. We have more treatment options, and we have good risk assessment. This will reduce the mental load on clinicians for sure.
No, that's really incredible insights there, Dr. Youssef. And you spoke about accessibility and affordability earlier. So I just want to get more insights from you in that respect, right? More than 4.5 billion people still lack full access to healthcare. And nearly 100 million fall into poverty each year because of healthcare cost. I mean, it's really difficult to wrap that number around your head, But here's the question: can AI help change this? How do you think technology, especially AI, can play a role in making healthcare more affordable and accessible, especially to people that really need this?
Regarding this topic, we are sure that AI is going to help. There are a lot of things that he can help because to make sure the health is accessible to more people and is more affordable. Can tell you a lot of examples like in early diagnosis and preventive care, AI it can enable early detection of disease. It's through predictive analytics, and this will help through image analysis and patient data review, which will prevent costly treatment and hospitalization for advanced conditions. So if you have preventive care, for sure, we are having less expenses because we are catching the disease earlier. This will help for sure being treated at a less costly process. As well, it's about streamlining the administrative processes when administrative costs are because they are major contributor to healthcare expenses. So AI can automate the task, such as claim processing, billing, and patient data management. It will reduce the overhead. By this, when you are decreasing the cost, this will affect directly on the expenses on the patient.
Okay. That's very insightful, right? If AI can reduce the operational costs, which trickles down to making healthcare more affordable. Have you started implementing anything in your hospital itself, Dr. Youssef?
Let me tell you, for the time being, I can tell you, we are talking a lot about AI, but unfortunately, the hospitals, maybe we'll talk about it later on. And this,
sure.
Still, they are not convinced that AI is a solution. It's not the complete solution. Still, you need, we used to, when the electronic medical record era started, it was 20, 30 years ago, we are still having problem with the executive in the hospitals to convince them that investing in electronic medical record, it will have excellent return on investment in terms of medical error, in terms of the decreasing the expenses, in terms of less overhead burnout on the physician, and less overhead on the administrative work. Still till now, they don't believe in this. Now with AI, it's another challenge for us. So still, not all hospitals are thinking seriously about being ready for the AI era. Especially, we had our meeting 2 weeks ago in Abu Dhabi, the Arab Hospitals Federation. It was the meeting for the MedHealth 2024, and we had a circle with the most reputable CEOs in the area. So they were all talking about the achievement of the hospitals, and in fact, they represented the most important hospitals in the regions. But I tried to ask them, are they ready for this era of hospital without all concept? I hope if we can talk about it later on. Okay. So they were not ready. Still till now, they don't think it is time. Although I think if you want to be in the market of healthcare, hospitals should put from now everything what is needed in order to be ready to use the apps, the AI apps in healthcare, to use the technology of telemetry, to use it's very important. I wish we can talk a bit about the precision medicine, genomics. This is all important because in the future, people are not will not accept to be treated in hospitals. Most of them, they want to be treated at their house, at the places, in the work, in the mall, whatever. They don't want to go to the hospitals. The system, the healthcare system is going to change. The concept of smart hospital is already starting, and the design, hospital design, architecture wise, it's going to be changed when you are dealing with a smart hospital.
No, what you said makes a lot of sense, right, Dr. Youssef? Anytime we speak about something like digital transformation, a lot of focus is given on the technology itself, but then not enough is spoken about the people. Like you said, a lot of people are very resistant to change, right? We get used to the old ways of doing things, and when something new comes up, we just don't want to get out of our comfort zone and try something new. So,
Honestly, that the physicians are the most resistant to change.
what do you do about that, Dr. Youssef? When the physicians, when the doctors, when the business leaders in healthcare are not open to change, how do you go about that? How do you go about convincing them?
Let me tell you first. In the hospital, in the healthcare system, in the hospitals, the most important group that we rely on are the nursing team. They are very important. They help us a lot because they are not only, they are so helpful in being the champions in the implementation of the digital transformation. And now with AI, I'm sure it will help more. Then we start with the residents. Usually in hospitals, when we have university hospital or teaching hospitals, the residents will be more easy to work with, not than the physicians, the attending physicians. And in order to approach the physician, it's a very hard task, especially the elderlies who are not digitally oriented. Okay, so the digital literacy is very important in this issue. So we work on them, trying to show them exactly what are the benefits, trying to show them examples on the champions in the hospitals who are using digital electronic records. It will help them seeing more patients, less time spending on administration, and having more income. When they see more patients, they will have more income. So you have to play it this way, financially, mentally, all the things that will try to make sure to convince them that they should learn how to use the system. And at the end, in hospitals now, if the physicians that are resistant, they cannot work. Sometimes there are systems in the hospital. If you are not using the electronic medical record properly, they could not work, because now there are a lot of hospitals who are completely paperless. So they have to, but we have to make sure to be easy with them, because, we should not put more load on them. The doctors are very stressed in the hospital. We have to try to show them how things will help them to make things more easier.
I mean, that's really good tips. And to our audience, if you're from the HR or learning and development program, working on change management, those are really good inputs from Dr. Youssef that you can apply. Now, Dr. Youssef, you spoke about smart hospitals, and I'm very curious to know what's happening in that space. What are some of the most exciting developments? Tell us about smart hospitals, first of all. How does that work?
This is great. This is my very
like your baby? Yeah.
It is my baby, exactly. But to start with, I'm an orthopedic surgeon, okay, but now I'm into this because I have to make sure that these systems will be implemented properly. It will help a lot. There is smart hospital concept and there is concept of hospital without walls. They go together. So the hospital without walls concept it is evolving alongside with the rise of smart hospitals, which integrate advanced technologies and AI to enhance patient care beyond traditional settings. We are not using now anymore the traditional settings. Uh, you know, the smart hospital, it points to a future of seamless, patient-centered healthcare that adapts to individuals' needs regardless of location. So it's not important to be in the hospital in order to get the proper care. And the vision of hospital without walls, it emphasizes the goal of bringing high quality, data-driven care directly to patient, creating a more, like say, inclusive, responsive healthcare system.
I mean, it's pretty mind blowing that the tech that we used to see in movies is now used to say lives in hospital is reality now.
Yeah.
So, Dr. Youssef, I have to ask you, right? You're an orthopedic surgeon. What sparked your interest or what led you down this path of AI and digital transformation?
You know,
Very curious to know. You have to tell us a story.
yes, when I was in medical school, I remember very well that it was. Yep, let me tell you this: our generation, we witnessed everything from no internet to AI. So when we were in medical school, I remember very well, and at American University of Beirut, it was in the 80s. We used to go to the library to do our search. We used to remember you take the card box that used to write on them in order to document whatever, and it take us in order to get any information for any research we're doing. It will take us weeks and months in order to come out with the data. Later on, we started to have this search, the technology, the internet, and now are now in the Google. We are beyond this when you start to have the Google search. So I found that it's very important that uh, life is easier now with this. So during my residency, I was always into technology and I was always searching for any things that will help me. It will help my education. So this is why it started, and we started later on working on implementing electronic medical records. I was always looking for assistance that will help us to help in our inquiries, in our work, like the systems in the clinical decision support system, in the electronic medical record, the computerized physician order entry, the CPOE system, and the AMR. It will help us a lot. It will decrease the tension and will help us more to be more concentrating on patient care. So this helped me. And now with AI, things are more attractive. So I'm into this. So I used to work in parallel doing my surgeries and working on the technology now. Few years I stopped my practice. I'm working all in technology, AI, and implementation.
That's a really inspiring journey, Dr. Yusuf. And, I really feel that there should be, because being a doctor, you understand the challenges of physicians, you understand the challenges that patients go through, and the transition from that to, digital and AI, it's a perfect balance, isn't it? Because you know the challenges of both worlds and you can find better solutions. That's wonderful.
It's very important. Yeah, the end user is being involved in the implementation of any technology because they know more than the people who are creating the systems. So so this is why I feel that I'm being useful because I know exactly what we need as physician, and I'm on the other part and the technical part. I'm working how to make things easier. So it is very important for the end user to be involved. Yes, yes.
Really inspiring. Dr. Youssef, now before we jump back into the technical discussion, right? I know you're a huge fan of The Resident,
Yeah.
the TV show, and for good reason. Now, for our audience, if you don't know about The Resident, it's a medical TV series that really pulls back the curtain on all the challenges in the healthcare system, focusing on the lives of residents, doctors, and patients. Dr. Youssef, I have to ask, what makes The Resident your topic? Why not Doctor House? Why not Grey's Anatomy? Why The Resident?
You know, I have watched. I am a fan of series, not only this. So I watched everything, all the series, not only the healthcare. Lately, I used to stop watching healthcare because a physician watching series in healthcare sometimes it feels like it's boring for him because he does not want when he wants to leave the work, he's go to do something else, not going back into the medical. Okay, so by chance, I was reading, I was searching for a new series to watch. I found this The Resident, and I said it's okay. I don't want. I started it. Really, it is an amazing series. There are a lot of things in it. You know, it blends the hospital drama with the real world issues. You know, and it gives viewers a mix of, let's say, medical crisis with ethical dilemmas and personal stories. And the production is excellent. The cast, they are superb.
I love. Who's your favorite character?
For sure, Gora.
Nurse Nevin. I enjoyed the show myself.
You watch it at the end?
Yes, I have. I have watched The Resident. I love Nurse Nevin. She's
We
so.
want to think about the what will happen, because yesterday I was watching what happened with Nevin. So
No, don't tell me. Don't jinx. No, no, no. Don't tell me. I'll watch it for myself.
yeah, I will not tell you. You should watch it because it's
I will. What I love Dr. Okafor as well. She's very smart.
yes.
Right?
For Bell and Dr. Bell.
Dr. Bell.
But, I feel like that Conrad,
Yes.
he is a character. The way he acts,
Yeah.
his character, the way he acts, I felt myself like him. This is what I used to be as a resident in him. You know?
Yeah. There's this rebellious charm.
Exactly, he was doing. He is smarter for sure, because the way that he described how he is diagnosing cases, really,
Yeah.
it is impressive. And you know, what is impressive as well in this, that although it talks about medical ethics and corruption in the States, about the medicine, which is we see it every day, and I was surprised that they are talking about it out loud on series, which is excellent, and talking about this fight for justice as well. But what is very important about the medical innovation, it is our topic now, how they are using medical innovation in that hospital, how they're using the electronic medical record, the iPads, how they're trying to make sure about any equipment, use the latest medical equipments in this. So it is complete a series that shows everything, and I really am enjoying it, and recommend it to everyone.
So viewers, if you're listening, please check out the show, and you've got to leave your comments and tell us who is your favorite character. I'm Team Nevin. Dr. Youssef is Team Conrad. We'll see who wins the vote.